This morning we have been talking about prescription pill addiction, but also looking at the similarities between prescription pill addiction and addiction generally. And I just want to look at some of the health risks and consequences of prescription pill addiction. Now, the misuse of prescription drugs can lead to serious health issues. One, it can lead to dependence and addiction. And we're seeing a lot of that. Prolonged misuse can result in physical dependence and addiction, requiring comprehensive treatment and approaches. I want to comment on that because this is what opens that whole that 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 doorway to addiction to prescription pills. A lot of people would start off young people. I've seen a lot of young people going to university and all of that, and now facing the challenges of, you know, juggling their social life, their emotional life, their educational life, all of that. You know, teenage years is a time when, as a lot of people have described it, the brain, the hormones hijack the brains. It is a time when a lot of things are happening in the developmental process of all human beings. Boys are discovering that their voices is changing. Girls are discovering that their body is changing. Same thing in boys as well. And the girl who used to be like a sister to them, now they're starting to see them as a sex object. You know, the whole psyche of both boys and girls are changing. There's at that time peer pressure seems to be more pronounced, who has a boyfriend, who don't have a boyfriend among girls, and similarly for boys. And I go back to that time and I could remember those days. And when you would be introduced, we go by the river to make a lime, and somebody have a cigarette that they stole from their father, and they'll take it up and light it up, and we'll all, or satisfy our curiosity or demonstrate our manhood. I could smoke without coughing, and similarly with drinking a beer in one drink, and all of those things. And we get introduced to these drugs at that stage. And because children are not only curious about schoolwork, especially if it is not presented in a very attractive, uh, likable way, I would say. Schoolwork sometimes could be a pain in the butt, as we say. So that there's a lot of challenges on young people, and this is why, in my experience and research, we've seen a lot of people gravitate to psychotropic, mood altering substances at that stage of their life, because it is very difficult to cope with all that is happening, the jilting and the infatuation and all of that, and then feelings or the fear of failure. And sometimes parents are putting so much pressure on the children to achieve. Not only the parents, but sometimes the other siblings have done so well and have set up themselves as a benchmark for the others. And I know of one individual who would literally become severely ill around exam times because all his siblings, the older ones, were doctors and had, pharmacists and all of that. And he was scared that he would fail. He will not be able to meet that standard and would get severely ill. And there is a condition in psychiatry called hysteria, where I've actually seen a child, a young person facing exam while I was in Jamaica, who hand became paralyzed. And as a result, they could not write the exam. And it was really because of hysteria. So I'm saying there's a lot of things happening there. And what I'm seeing is a person who was introduced to drugs, especially those of us in the middle and upper classes. We have our own private bars, we have our own medicine cabinet, and our children see that, we entertain, and every evening we take a glass of wine or two, and we have a nightcap, and that's a lifestyle. And not everybody who drink will become alcoholic, but everybody who became alcoholic, they started with that first drink. And this is how these children And at that level, they have, I mean, the opportunity to entertain friends. They get invited every weekend to parties. And in these parties, there are those in the party who have access to other drugs, designer drugs, and they will bring it and say, "Well, have you ever tried this? The mollies and the ecstasies and all of that." And you know, and they get introduced to these things. So that what happens now? They start using on the side, and at the first sign of it or incidence of it, the, the family members, the first the first line of action intervention, they will take the young person to the psychiatrist. And I'm not faulting the psychiatrists or the doctors, or they may take the person to their regular general practitioner because they have a relationship with them, and they can speak to them in confidence, and they feel comfortable to go and discuss, well, look, this boy, we discovered his paraphernalia in his room, and we discovered that he's, might be using these drugs. And I have said it so many times before. Now, what does the doctors have in their toolkit? A lot of times, they what the young person going to see the doctor will be presenting with is withdrawal symptoms. They now are unable to sleep. They're starting to suffer with anxiety or depression because of the drug use and the withdrawal from the drug. Because even if you don't have a psychiatric problem and you start using any one of these psychotropic drugs, you can become addicted to them. And when you use them, yes, you'll be able to sleep. It will reduce your anxiety. But when it is wearing off, you are going to go into withdrawal. And withdrawal is really the same symptom that you are using it for are going to be coming back with more intensity. So that one of the of the withdrawal symptoms of sleeping pills is insomnia. That's the first symptom they list in the textbooks. So that you're taking the sleeping pills to sleep, but once you start taking that, when it is withdrawing from your body, wearing away, you will not be able to sleep. So what happens? You're on a merry-go-round. Now you're taking it to sleep, and you have to take it now because you took it the day before. And that is how the dependence starts. And common sense will tell you and anyone that you can't use drugs to treat drug addiction. I saw that when I was at Cora, when I was at St. Anne's, when I was at Wardley and Ward 1 in San Fernando, at all the psychiatric units, the main stay there, well, they do use counseling, but to deal with the withdrawal symptoms, you get put on these psychotropic drugs. And the problem is not the doctors, really, it is the system where Trinidadians, we are credited with being very smart. So we read the label on the box or the package that we got, and we see the name of the drug that was prescribed. And so we make friends with the pharmacies, or we get people who have access to it in the hospitals. And I'm aware of that. I work in all the hospitals, and I know how people get prescription fills in the hospital because they have friends there. And it is probably one of the reasons why we never have a good supply of medicines, because the medicines are being farmed out by people who work in these hospitals, and not only in the public hospitals, but in the drugstores. There are drugstores who unashamedly package sleeping pills and sell it to people under the counter. So that one of the ways to deal with this, and I would mention that hopefully before we close the session, is that we'll have to have more regulation, more stringent regulation of and policy treating with all of these addictive substances, not only the penicillin and the other drugs, but also the sleeping pills and all of those that can make people addicted. We need to have rules and strict enforcement of these rules. So coming back to, yes, these drugs cause dependency. And what happens now, and let me continue the story. A lot of These people, they hear about me, they listen to the program, they bring their relatives to see me, and yes, I find out that they are now on psychiatric drugs. I don't want to call the names of them, but they're also supplementing it with alcohol and marijuana. Why? Because every drug that we use, there's a tendency to develop tolerance. So if you were prescribed 5 milligrams of a sleeping pill, after a little while, if you continue to use it, your body, 5 milligrams is not going to put you to sleep. You'll have to use 10. And now, maybe even when you take 10, sometimes you can't sleep. And then you can't go to the doctor and tell him to increase the dosage because it's not always easily accessible. And they quickly find out that, look, I could make up for the deficit by using alcohol, and the alcohol is right there in the bar in the house, and that's where the trouble starts. Now that trouble doesn't only end there. Even though they come for counseling, they go to AA meetings. The doctors will tell you can't come off the drugs like that. Some doctors, even I'm told by patients, the doctor said, I shouldn't come off of this. It's dangerous for me to come off this. And parents have asked me that too. Is it safe for him to come off the drugs? Because the doctor say he'll have to take that for the rest of his life. Yes, because there's no other strategy known to the medical profession in using chemotherapy. There's no other way to take them off. Yes, there's the whole question of being able to wean them off the drug gradually, but that will entail the person having a very, very strong desire to come off the drugs. But what happens with a lot of these people is they would have honestly tried to stop on their own, but have failed so many times secretly that they have convinced themselves that, look, I can't stop. Because they know when they try to stop, it is going to be very painful. And again, I have repeated this on this program that no alcoholic or drug addict is going to stop using drugs unless to continue becomes more painful than stopping. Because stopping is very painful. The withdrawal symptoms it includes insomnia, depression, anxiety, muscular pain, heart palpitations. You feel like a band tightening around your head. You have a metallic taste in your mouth. There's a whole lot of strange symptoms that could accompany withdrawal from sleeping pills and tranquilizers and all of these things. And even alcohol and the other illegal drugs. You can have, in fact, the withdrawal symptoms from marijuana and cocaine and even alcohol is not as severe as the withdrawal symptoms from the benzodiazepines, the sleeping pills, the antidepressants. So that it is several times, I'm telling you from experience, it is several times more difficult to get a person to come off, take them off the prescription pills. And that's why I'm dealing with that subject this morning. Because a lot of people seem to think, well, look, I'll go to A and stop the alcohol because the alcohol is what people object to. You get drunk and you misbehave. But when you take the sleeping pills, you don't really get that drunk to fall down and misbehave. You just go to your bed. But the next day, you are very irritable. You are very anxious. You are very short-tempered. And it can even go to the point where you start hallucinating. And I have had patients who, after prolonged use of these prescription pills, if they try to come off it, they start seeing and hearing things that are not there. And some of the consequences, as I was going to mention, is that it can cause, um, men, well, it can lead to an overdose because the people who prescribed, who formulated the sleeping pill, when they did their trials and their tests, they did not try it with people who were drinking alcohol or using cocaine or marijuana. They use it on normal folks. So that when you take the sleeping pills and you drink alcohol, or worse, you drink alcohol, you are drunk, and then you go and you grab the sleeping pills and you don't even know how much you took. and then you pass out on the floor. And instead of putting your brain to sleep, now the sleeping pills have put your heart to sleep, which means you are dead. And a lot of people have died from overdose of prescription pills in conjunction with other drugs or even prescription pills alone. Now, misuse can exacerbate mental health conditions leading to depression, anxiety, or other psychiatric disorders. Now, it's really a rock and a hard place here, because yes, having worked in psychiatry myself, I've seen a lot of people who do not take the medicine and become very sick, especially schizophrenics. But because of their illness, they can't be trusted to take their medicine as it is prescribed. Now, let me make it clear. I am not saying people should not use their prescription pills, but please take it as it is prescribed. If it is not working for you, if it is causing side effects, then go and talk to your doctor and review your medication. And it is your business to research it and see what are the side effects so that you will know what you're feeling this morning is probably a side effect of the medication. And you need to discuss this with the doctor. My position is that people should not have that to take psychotropic drugs should be a last resort. Yes, you have people who, for whatever reason, carelessness, being, hardened, as we say, they become addicted, and now if they don't take it, they become psychotic and they're mashing up the place. They can be a danger to others, and they have to be taken into care and under medical and psychiatric supervision. And they have to be probably sedated to restrain them from that damaging themselves and others. And there is a place and a proper use for that kind of intervention. But I'm saying, barring that, every person should seek using chemotherapy should be a last resort, even for practicing professionals. It shouldn't be the first line that people should immediately go to. If you're having difficulty to sleep, if you are stressed out, if you're feeling depressed, if you're feeling anxious, there are other natural methods to deal with it. And it is one of the main reasons that when I was working at Cora Hospital and I was introduced to the use of acupuncture in the treatment of drug addiction, I saw the opportunity where acupuncture could be used to treat depression, to treat anxiety, to treat insomnia, not only as a consequence of withdrawal from drugs, but generally. And I have, since 1992, had a private practice here where I'm seeing a lot of patients. In fact, after this program, I will be seeing patients with these problems. And it is a very, very, I have been able, but for the grace of God, I would say, able to help thousands of people. And because of this program, a lot of people have been able to access that kind of care and treatment. And of course, in the future, again, if you look in my programs that I've posted, you would see I have given very valuable suggestions to people who suffer with insomnia, who suffer with anxiety and stress. I've even done a program on how to find happiness. And I've also dealt with things like meditation. I've dealt with the 12-step program that is used in Alcoholics Anonymous and Narcotics Anonymous that has found worldwide appeal and is helping people all around the world to come off drugs and to stay off drugs and to find that happiness and serenity and productivity and purpose for living again. So I am always open. My numbers are there, 6713040. Of course, if you call that now, I wouldn't be able to take the call. I'm on the program. But there's another number there, 768-5925, that you can text me even now if you have a question on anything that I've said. And I would try to respond to it before our time is up, or definitely in the next program. So going back to how do we address these issues? One is by implementing programs to educate the public. And that is what this program is about. I have nothing against people who could take a drink and enjoy themselves, yes, I don't recommend using marijuana or any of the illicit drugs, or but I'm saying that I know that there are people who are driven by curiosity, peer pressure, whatever, and the availability will if start using, and some of them will become addicted. And let me say at this point, all the figures that I've given really is just the tip of the iceberg. It never really describes the whole problem, because these being diseases of denial, people don't come forward and say, look, I am an alcoholic or I'm a drug addict because of the stigma associated with it. So coming back to how we address this, implementing educational programs in the public, especially with the youth, and about the risk associated with prescription drug misuse. And we are doing that this morning. Monitoring and regulating, that is, enhancing prescription monitoring programs to detect and prevent misuse. I spoke about that earlier on. Then treatment services, expanding access to treatment and rehabilitation services for those struggling with addiction. And I dare say at this point, in Trinidad, we have programs to help adults, but we really don't have a program for young people, teenagers, because as I said earlier on, even by age 10, most children have already tasted alcohol in some form. They know where it is available, where the marijuana is available in every community. They know the people who are selling it, and they are exposed to it. So that we need to educate the public about this. And we know from experience that some people are going to, as we say, fall through the cracks. So that we have to have rehabilitation facilities in place. And having been through almost all the drug systems here, working in the field of drug addiction, I know that there's not nearly enough treatment programs. And in fact, as I say this, I really bemoan the fact that we had a very effective program at the Piparo Empowerment Center, and the previous government did not see the need to continue it. At present, well, the last I heard is that they were going to repurpose it, and I don't know what's happening there, but I maybe I will speak about that program because I was the first director who actually set it up. And that program was really intended to be an alternative to custody program. That is to say, all these young people or people who were charged with offenses and appearing before our various magistrates and judges in the United States and other places where that program was developed, it's called a therapeutic community. What would happen is when a young person go before the court, or any person, and the magistrate realized from the probation report or from the lawyer that the offense was drug related. That is, they were drunken driving or they were stealing to support their habit or whatever. There's evidence of addiction, rather than they would always give the person the option that, look, you can either go to jail or go for treatment. And I'll tell you, 99% of the people will choose to go for treatment because treatment is a more humanitarian, mild option, where you still have your freedom and you get a chance to learn how to again, rehabilitate yourself. And it's much more pleasant than going to prison. And those programs are very, very successful because the person is there with a mandate. They can't run away from the program. They cannot abandon the program because if they leave prematurely, they're going straight back to jail. And every week, the parole officer will get a report from the treatment facility to say whether this person is actually applying themselves to the program or not. And the person knowing this, they become the best clients in those therapeutic communities because they know that there's a sword hanging over their head, a consequence if they don't apply themselves to the program. And soon enough, they understand, look, this is for my own good. And here's a chance at last that I can straighten out my life. I can get back into mainstream society. I can get back my family. And those programs have become very successful. And I'm hoping anyone listening who have the ears of the minister or anybody in power, I would be very happy to have a discussion with them concerning the reestablishment of an alternative to custody program, which I think that it is long overdue. We should have had it like yesterday. And again, finally, we need to have research and data collection, gather accurate data on prescription drug use patterns, aiding in the development of targeted interventions. Now, addressing prescription drug addiction requires a multifaceted approach involving education, regulation, treatment, and ongoing research to effectively mitigate this public health challenge. And indeed, in Trinidad, I think we do. It's long overdue that we start paying attention to this. And today, I want to let our brothers and sisters know that, look, if you're having a problem with sleep, with depression, with anxiety, do not rush. Even if you go to see the doctor, do not, and I'm speaking even to my brothers and sisters in the helping professions, do not be too rushed to prescribe chemotherapy, because even those that are not causing physical addiction, they can cause psychological addiction. And I mentioned the placebo effect that drugs can have. And even psychological addiction is even more difficult to take people. It is easier to take them off the physical addiction by substituting other things, acupuncture and so on. But this psychological addiction can remain with us for the rest of our lives. And we'll need continuous counseling and this is why the support groups, Alcoholics Anonymous, Narcotics Anonymous, are critical. And as I say this, for all those people who are attending AA and NA, if you are still using psychotropic drugs on the side because your doctor is prescribing it, you need to work out a plan very quickly to get yourself off those psychotropic drugs. Otherwise, it's just a question of time when your recovery will be precarious. It will be very easy for you. And I've seen so many people, all good, well-intended, trying to come to AA and trying to stop using drugs, but because they're still on the psychotropic drugs, the prescription drugs, they keep relapsing because the body doesn't discriminate whether it is alcohol or whether it is sleeping pills. Both of them are sedatives and both of them keep getting you drunk. You understand? Although one may be quite acceptable because the doctor prescribed it, your family's going to say they don't see anything wrong with that. But you are setting up yourself. And if you out there going to AA to stop drinking alcohol and you're still smoking marijuana, then you are also setting up yourself. So I will end the program at this stage, and I want to thank all of you for listening. And to remind you, this program will be on next week, Thursday again at 9 a.m. And it will be rebroadcast on radio and TV Jagriti at 10 p.m. tonight. So thank you, Sitaram, and goodbye until next week.